patient Penelope has been a chronic smoker since the age of 10. On the day of this incident, she had smoked her regular pack of cigarettes and proceeded to play a normal game of basketball with her friends. It was then that a normal day quickly turned into a medical nightmare.
Penelope, are you okay? I can't breathe. We need an EMT.
Our patient Penelope is a 50-year-old woman whose last physical examination was February of 2020. Penelope consistently smokes 1 to 2 packs of cigarettes daily, eats an unhealthy diet, but participates in moderate exercise weekly. Penelope also reports that she consumes 1 glass of wine per day. When she received her health history report form, she checked off that she has a history of high blood pressure, heart murmurs, sleep apnea, and is borderline diabetic. Her family medical history includes coronary artery disease and ventricular tachycardia on her dad's side of the family, and lupus from her mom's side of the family.
The patient reported that their symptoms included a lack of energy, chest pain, and shortness of breath.
Penelope, we've heard that you've been feeling short of breath and have had some chest pain. We're going to run some tests to identify the cause of these symptoms.
Dr. Wilson, here's your formal test.
Thank you. The first test we performed is the spirometry test. The patient breathes into the machine in order to determine how much air they can breathe in and out of their lungs. The test will be conducted 2 additional times in order to verify that the results are consistent. The forced vital capacity, which is how much air one can exhale after breathing in deeply, and the forced expiratory volume, which is the volume of air that an individual can exhale during a forced breath, are measured.
The second test we will perform is a chest CT or computed tomography scan. A chest CT scan uses specialized X-ray equipment to take detailed images of the lungs, heart, blood vessels, and airways. This will help us determine the causes of the patient's shortness of breath and chest pain.
The third test we performed is the pulmonary function test. The patient breathes in and out of a mouthpiece, and this shows how well the lungs are working. The test measures lung volume, capacity, rates of flow, and gas exchange.
To refresh our memory on Penelope's case, Penelope is a 50-year-old constant smoker who suffered from a sudden attack while playing basketball. She has high blood pressure, heart murmurs, and sleep apnea, and has a family history of several heart diseases. Finally, her strongest symptoms are a lack of energy, chest pain, and a shortness of breath. Pause. Now it is time for the class to reflect on Penelope's condition. After an extensive review of the test results, our team of doctors and medical staff came to the conclusion that Penelope suffers from a severe case of COPD.
Hello?
Hi, Penelope. This is Karen from UCLA Medical Center. Your doctors would like to see you tomorrow at 3 to discuss your test results. Would that be convenient for you?
Okay. Hi Penelope, so your test results came back in and your chest CT scan shows that you have blocked airways and enlarged arteries.
Your spirometry test results indicate that your FEV1 ratio is 47%. This indicates an abnormal airflow rate and that your lungs have persistent airflow obstruction. Your spirometry test also told us that your peak flow rate is 68%. This represents your maximum flow rate of air during the forced exhalation, which indicates that your lungs have blocked airways. Penelope's pulmonary function test indicates that her total lung capacity, which is a maximum amount of air the lungs can hold, is 4 liters. The normal value is 6 liters. Her residual volume, which is the volume of air that remains in the lungs after maximal exhalation, is 2 liters. The normal values are 1 to 1.2 liters. Residual volume in a patient with COPD is actually higher due to an incomplete emptying of the lungs. Her diffusing capacity for carbon monoxide, which measures the lung's ability to transfer oxygen from inhaled air to the bloodstream value, is 43%. This indicates that she has damage to the alveoli and impaired gas exchange. The normal value is greater than 75%.
COPD has a vital impact on the body's systems and organs because at advanced stages, the lungs can no longer provide the body with enough oxygen. Low levels of oxygen place a lot of stress on the heart, which in turn has to pump more blood through the lungs. This causes the heart to become weaker. COPD damages tissue, which reduces a patient's elasticity and a patient's ability to exchange oxygen and carbon dioxide. This results in the common coughing and wheezing symptoms that are associated with COPD. COPD's negative symptoms can result in anxiety, depression, and other mental illnesses due to the various physical limitations it puts on a person.
COPD has an impact on homeostasis since it impairs the body's ability to maintain a balance between the intake of oxygen and the elimination of carbon dioxide. This can lead to respiratory acidosis, resulting in a large accumulation of acid in the blood, which in turn disrupts the homeostatic balance of a normal pH, which affects multiple organs and body systems in the body.
There are many factors that are possible contributors to Penelope's severe condition of COPD. Since Penelope smokes, exposure to tobacco irritates the airways, causes damage to the lung tissues, thus reducing their ability to function properly. Also, exposure to harmful substances in the environment can also contribute to the development of COPD. This includes exposure to air pollution, dust, and heating fumes. One idea for a new and innovative treatment option is gene therapy. Researchers could conduct genetic studies to identify specific genes that are associated with an increased risk of COPD. They can analyze large-scale genetic data sets from individuals with COPD and healthy controls. Once specific genetic targets are identified, researchers would develop gene-based interventions to modulate function of these genes. Gene editing is used to modify the genetic activity related to COPD.
Then, delivery systems would be developed to deliver the therapeutic genes to the target cells in the lungs. Nanoparticles or other advanced delivery systems can be used to ensure targeted delivery to the affected areas of the respiratory system. Unfortunately for Penelope, her case deteriorated greatly to the point that no medical advances would be able to reverse the damage done. The biomedical professionals essential to our case are the pulmonologist, the EMT, and the nurse. We'd also like to give a special thanks to the most important part of our case, the patient.